Hello friends, I am Dr. Prashant Sharma and you are watching MEDICO'S Hub. In this video we are going to discuss about the structure and functions of spleen. The spleen is the largest lymphoid organ. It is located just below the left side of diaphragm underneath the 9th, 10th and 11th ribs. Now this is the section of spleen. If you can observe this is splenic artery. It is also known as lineal artery, and this is splenic vein or lineal vein. This splenic artery is divided into 6 or more arteries. These are known as trabecular arteries, and these partitions are trabecule. By the help of trabecules, spleen is divided into few compartments. It appears just like a large size lymph node. Now we are taking a compartment having boundaries of trabecule here. So in this compartment, this partition is trabecule, and this is the trabecular artery or trabecular artery. As soon as the trabecular artery enters a compartment, it is termed as central arteriole. This central arteriole is surrounded by a sheath of T cells which is known as periarteriolar lymphoid sheath. This is periarteriolar lymphoid sheath, and this is a T cell area, that is T cell rich. Then there are lymphoid follicles. This is a lymphoid follicle. This lymphoid follicle is B cell rich. This periarteriolar lymphoid sheath and lymphoid follicle represents the white pulp that forms 25% of spleen, and it gives active immune response by cell-mediated immunity and humoral immunity. The spleen is divisible into white pulp and red pulp. White pulp is 25%, while the rest of the compartment is made up of red pulp. Red pulp is represented by sinusoids. These sinusoids are filled with blood, and these are mainly concerned for identification and destruction of RBC, which are old, defective or dead. Sinusoids are also having macrophages, and the cord-like spaces in between the sinusoids, which is representing the connective tissue of a spleen, are termed as splenic cords. These are splenic cords. These are also known as cords of Billroth or red pulp cords. These are representing the connective tissue of spleen, which is having reticular fibers, connective tissue cells, macrophages and monocytes. It is the reservoir for more than 50% monocytes of body. and these are representing the marginal zone sinus, which is separating the red pulp from white pulp. So these are forming the red pulp, that is forming the 75% of spleen, and the main purpose is the mechanical filtration of blood. Now we'll discuss the blood supply. Blood supply of spleen starts with splenic artery, which is also known as linon artery. Then it is divided to 6 or more trabecular arteries. We can observe here, trabecular arteries are there. These trabecular arteries will enter the compartment. This is a trabecular artery which is entering a compartment, and then it is immediately surrounded by periarteriolar lymphoid sheath. Then it enters a lymphoid follicle. This is a lymphoid follicle. There may be some germinal centers also, which are developed after interaction with antigen. So this is a lymphoid follicle, and when it continues into the lymphoid follicle, it becomes the central arteriole. So it continues as central arteriole. After emerging from the lymphoid follicles, this central arteriole will give rise to 15 to 30 penicillar arterioles. So 15 to 30 penicillar arterioles, which are also known as penicilli arterioles, they will radiate out from the central arteriole. Now the capillaries will be formed by these arterioles. These capillaries are having sheathed ends. This is known as sheathed capillaries. A part of capillaries is sheathed, that is, some monocyte derived macrophages and the reticular cells are entered into the wall of these capillaries for identification and destruction of odd RBCs, that is old, defective and dead RBCs. These sheathed capillaries will open in two areas, either directly into the sinusoids or in the cords of Billroth, that is splenic cords. It's important to note that major blood enters the splenic cord and minor blood enters the sinusoid. So this is forming closed circulation, while this is forming open circulation. Finally, blood has to enter the sinusoids even from the splenic cords. Then sinusoids will give rise to small veins. These are known as pulp veins. These pulp veins will reunite and form the trabecular veins. These trabecular veins, these are 6 or more in number, they will fuse to form a common splenic vein, which is also known as linon vein. And finally, it will open into or contribute to hepatic portal vein. So this is the structure of a spleen. Hit the like button, share and subscribe our channel to get the latest updates and notifications.